Hi, welcome back. We talked about adverse events, so now we're going to take it up a notch and we're going to talk about serious adverse events. And this will make sense shortly. There is a difference between just a regular adverse event and a serious one. So to review, just as a refresher, if you just finished the adverse event lecture, this will be cakewalk. If you are like me and slept overnight, you might have forgotten. So it bears repeating. An adverse event is any untoward or unfavorable medical occurrence, in a human subject, including any abnormal sign, symptom, or disease temporally associated with the subject's participation in research, whether or not considered related to participation in research. So it's a bad medical finding, and it happens while the person's on a study. So that's an adverse event. You got to know the adverse event. It's the foundation for a serious adverse event. So what is it? We'll call them SAEs just for brevity's sake. So what is an SAE? So an SAE first has to be an adverse event, and it has to meet any of the following criteria. Results in death. I don't think you have to be really insightful or a deep critical thinker to realize that death itself is going to be a serious adverse event, right? That's the worst adverse event you can have. It's an adverse event that is also life-threatening. By life-threatening, we mean places a subject at immediate risk of death from the event as it occurred. As it occurred, not if it was worse, but as it occurred. So if it was life-threatening, and a good example of life-threatening would be like a pacemaker failure, or bone marrow suppression, where the bone marrow stops producing all those blood cells. Another example requires inpatient hospitalization or prolongs an existing hospitalization. And by prolonging an existing hospitalization, there's a really good, reliable way that insurance carriers, for example, know that if you get a hip replaced, you should be in the hospital for 5.3 days, for example. I just made that up, so don't write it down. But that's a good example. Insurance carriers know how long it is reasonable for someone to be in the hospital if they get a hip replaced. So if you are in the hospital for 6, 7, or 8 days, that is no longer normal. And that event extended the hospitalization. And let me just stop right here and say that as a research coordinator, when you're new, some of these will require you talking with your PI. You're never going to be working alone. You're always going to have really good, I hope, really good, reliable professionals alongside you that you can go to and you can say, hey, I need some guidance on this, or I'm not really sure, did this prolong the existing hospitalization? After a period of time, you'll start getting really good at this. And even when you get really good at it, sometimes it's really helpful to run things past another person just to say, am I understanding this correctly? So don't let this overwhelm you when I talk about things like prolonging existing hospitalizations. Well, some other things. Results in a persistent or significant disability or incapacity, and that's pretty large. Some examples, a good example would be peripheral neuropathy. So when peripheral neuropathy happens, the nerve endings, typically of fingers, will be damaged and they will become very sensitive, and sometimes people lose that ability when they have nerve damage to do things like button their shirts, button pants, things like that. We would consider that to be a disability or incapacity, and it can be significant or it can be persistent. Again, a good example would be not a good example, but this might be another opportunity for you to talk to your PI or another research coordinator. Results in a congenital anomaly or birth defect. Pregnancy is always an exclusion on clinical trials because rarely are clinical trials performed to determine what will happen to an unborn fetus when they're exposed to an investigational drug. And so anytime a baby is born and they have a congenital anomaly or a birth defect while they are exposed to drug in utero, that's not surprisingly going to be a serious adverse event. Hopefully you won't get any of these. And then this last sort of general kind of catch-all, any other adverse event that may jeopardize the subject's health and may require medical or surgical intervention to prevent one of the other outcomes listed in this definition. And so this is very broad, this is very wide, and it's sort of like a big dragnet, and you'll catch a lot of other adverse events in here that, if they're not addressed, will result in disability, hospitalization, or death. So again, this is more discussing with your PI. Some examples here: Tylenol-induced liver failure, which requires treatment to prevent permanent damage, and drug dependency is always considered a serious adverse event. And I modified these definitions for the sake of space from the FDA regulations 312.32a. So here I'm going to give you a scenario. A patient on your trial at your center routinely requires blood transfusions. Today's blood work indicates he needs another blood transfusion, but he can't leave work tomorrow and has requested to be cannot leave work today and has requested to be transfused tomorrow. Since tomorrow is Independence Day and the office will be closed, arrangements are made for the patient to be transfused at Methodist Hospital. Does this qualify as a serious adverse event? So, didn't result in death, any of those other things. This is really, you could say this is a hospitalization, and that is, I had this come up and I had a sponsor wanted me to report it as a serious adverse event. However, a serious adverse event is an inpatient hospitalization or prolonging an inpatient hospitalization. This patient is an outpatient, and the only reason he was sent to the hospital was for convenience sake. The office was closed, he needed to be transfused, and so he was sent to the hospital. And I will give you, and the reason I bring this scenario up is because it's not always just a yes or no. I want you to look at things very critically, and I want you to think about them. If, in fact, it had not been the 4th of July holiday, he would have come in the next day to the clinic and been transfused. So this is perhaps a little misleading. And so I made the argument that this was done for convenience sake. Also, you should bear in mind that inpatient hospitalizations typically start at 24 hours. So there is something called a short stay admission where it is less than 24 hours, so 23 hours and under. In that case, sometimes patients will be seen in the emergency room and they're not really sure whether to admit the patient or not. And so you can have this very short 23-hour observation stay, and that is not considered an inpatient hospitalization. So in this case, I made an argument that it was done for convenience sake, and additionally, it was less than 24 hours. So even if you didn't buy the convenience argument, I can make a very strong point that this was a 23-hour observation patient. So I said, no, this does not qualify as a serious adverse event, even though on the surface it looks like it should. Another scenario. Mrs. N has completed the asthma trial, is in follow-up. You phone her today and she reports she was hospitalized for elective cataract surgery last week. Is this a serious adverse event? Oh, this is really interesting because I just made a very strong argument for convenience sake. So elective cataract surgery, and she was in the hospital for that. Does that count as a serious adverse event? Well, the elective really has nothing to do with it one way or another. The fact that she was hospitalized makes this a serious adverse event, unfortunately. So now this is going to be a different way to categorize her adverse event. Now, the question really gets to be, is this cataract surgery, were the cataracts an adverse event at all? So if the cataracts existed prior to her going on study, so in other words, they were there at baseline, and they did not get any worse, then I would argue that this is not an adverse event. And if it's not an adverse event, it cannot be a serious adverse event. So in this case, I'm going to ask a lot more questions about the status of her cataracts and whether they got worse while they were on study. So I need to first establish that it's an adverse event before I can upgrade it to being serious. So for Mrs. N, I have some questions for her, and then I have a lot of questions for her chart. So I'm going to look through her chart, and I'm going to work with my PI to determine whether this is serious or not. It may or may not be, depending on what I find. Another scenario. As part of the study, your patient, Mr. G, has been admitted to the hospital for 8 days of intensive PK sampling. And if you remember back to the beginning of the semester, we said PK stands for pharmacokinetic. So these are blood and urine samples that we're taking from him. And he's being admitted as part of the protocol in order to get all of these samples from him. So 8 days of inpatient stay. On day 7, he develops a fever and general malaise, and then antibiotics are started. On day 9, his blood culture results are found to be negative, antibiotics are discontinued, and he is sent home. Does this qualify as a serious adverse event? So we admitted him based on the protocol requirements. So everybody gets admitted to the hospital for 8 days. So in that respect, it is a hospitalization, but it's something required by the study. Now this one's a little tricky, and I specifically gave us these tricky scenarios so we could sort of think about them a little bit. So he's supposed to be there for 8 days. On day 7, he develops a fever, so that's an adverse event, and general malaise, and that's an adverse event. Okay, because that's, I'm assuming, new. He goes home on day 9 because it's found out that he doesn't have an infection. This does qualify as a serious adverse event because it prolonged his hospital stay by a day. We expected to send him home on day 8, and he went home on day 9. So even though, in fact, he was healthy and there was no infection to be found, we extended his hospital stay by a day. And yes, this definitely would be a serious adverse event. So we talk about serious adverse events. Sometimes people throw around the terms severe and serious as sort of meaning the same thing. But when we're talking about adverse events, these words are very different. So we said that serious is a way to categorize adverse events. We have adverse events, and then we have serious adverse events, right? And we also have unexpected adverse events. So these descriptors are categorizing events. Severe, on the other hand, is talking about the intensity of the event, regardless of whether it can be classified as serious. So severe talks about intensity. And here's an easy way, I hope, that will help you sort of think about this. And this was a little something that was put in my head when I was a new coordinator, and I find it to be helpful. The example is a headache that is severe is not necessarily serious, right? So you can have a skull-splitting headache, right? You would say the intensity is significant, but that does not necessarily cause it to be categorized as serious. So if you remember the little headache example, that might help you to sort of not use those terms interchangeably when we talk about adverse events. So what is the role of the investigator in reporting SAEs? And you know, when I say investigator, I mean research coordinator, right? You're going to work closely with your investigator, excuse me, but it's going to be you that's actually doing the reporting. Now, the PI in FDA Form 1572, remember that was back one of those documents that you need to start a study. Every investigator who fills out a Form 1572 has to sign it, and it attests to this. I agree to report to the sponsor adverse events that occur in the course of the investigation in accordance with 21 CFR 312.64. I also agree to promptly report to the IRB all anticipated problems involving risk to human subjects or others. And those are those UPERSOs, right? So the PI is going to report things to the sponsor and then the IRB. The IRB has a specific role too. So the IRB has the authority to suspend or terminate approval that has not been conducted in accordance with the IRB's requirements, or, and this applies to us here, or has been associated with unexpected serious harms to subjects. So the IRB can, in theory, terminate a study because of safety issues. So the IRB, we're going to talk about reporting things to the IRB as well. So what are reporting timelines? So you have a serious adverse event at your site, and you need to let the sponsor know how much time do you have to let them know. Does it have to be the same day? Can it be the same month? You have 15 calendar days, and notice these are calendar days, not business days. The FDA works on calendar days, and thereby you, in terms of reporting serious adverse events, will work on calendar days as well. So you have 15 calendar days to let your sponsor know if you have a serious, unexpected, and related event. So serious meaning any of those 6 criteria we talked about. Unexpected, if you remember our last lecture, unexpected means unexpected with regards to adverse events that have been reported so far in the trial, or unexpected with regard to the disease under study. And then related means that this event is related, your investigator believes it's related to the investigational drug. It's caused by the investigational drug. So when that happens, when you have 15 calendar days to let your sponsor know about this. You have almost a little more than half that reporting time, 7 calendar days, if you meet all the criteria: serious, unexpected, related, and then fatal or life-threatening. So it really ramps up into 7 calendar days whenever you add the fatal or life-threatening criteria in there. So now this is really, you're going to stop what you're doing and you're going to let the sponsor know quickly when you have this kind of event that happens. So let's talk about the investigator reporting. I just told you the timelines you have to let everybody know what you know. So let's talk a little bit about the reporting lines for the investigator, and that means you. So when an adverse event is identified by the PI, it's going to be categorized into one of 2 things. The adverse event, and the adverse event gets reported to the sponsor via the case report form. If you remember way back, I had a diagram about the flow of data. And the case report forms will include adverse events, and then those get sent to the sponsor in a sort of nice, reliable, regular method. And then the adverse events get reported annually to the IRB. Remember, I said the IRB is going to want a continuing review of the study at least annually. So I'm assuming it's going to be an annual report. It might be more frequent than that if there's a lot of risk with your study. But at least annually, you're going to let the IRB know all the adverse events. Now, if it's a serious adverse event, it gets to be a little different. You're going to call your sponsor, or you're going to fax them, or you're going to upload something to the cloud or a web-based program. You're going to have some way to communicate the serious adverse event to your sponsor. And it's going to vary by sponsor, but it's going to be some kind of direct, very efficient method. So you're going to let your sponsor know either within the 15 calendar days or the 7 calendar days. And then you're going to do something similar with your IRB. Your IRB will say call, fax, email, cloud, web-based, whatever, hard copy, paper, who knows. But your IRB is going to tell you how they want that to communicate it to them. So the adverse events you can see are sort of done in more of a, I hate to say casual, but there's not the urgency in reporting the adverse events. They go in a very regular method. The serious adverse events are more stop what you're doing and call somebody and let them know what's going on. So this is sort of the 2 routes that those adverse events identified by the PI will be communicated to the sponsor and to the IRB. Now, we have to talk about sponsor reporting, because you've already sent information to the sponsor, and there are going to be investigators all over the country communicating with the sponsor. How does the sponsor do? What does the sponsor do? Is it just a big sponge that receives all these adverse and serious adverse events? What does the sponsor do with that information? So all the events get received from the PI to the sponsor. Adverse events then get communicated to all the sites via the IB. And what I mean by the IB is the investigational brochure. The investigational brochure is like the package insert that you already get when you get something from the pharmacy. So it includes everything that's known to date about the drug. It's an annual publication from every sponsor. So the adverse event that happens in Nebraska and Oklahoma, Montana, gets communicated to the investigator in Miami and New York and Charlotte via this investigator brochure. So all the adverse events are then sent out to all the sites in this investigator brochure. The sites then submit the investigator brochure along with their own information in their annual report to the IRB. Serious adverse events are a little bit different. As you can imagine, they were different with the investigator reporting them. They're going to be different with the sponsor reporting them. All the serious adverse events that come into the sponsor from sites all around the country are sent out to all the other sites via something called an IND safety letter. Some people call it a Dear Doctor letter. And this is a standard formatted letter that goes to, if the site in Miami had a serious adverse event, the sponsor then would send out the IND safety letters to every other investigator involved in that trial. The sites then in turn submit the IND safety letters to their IRB promptly. Their IRB wants to know what's happening with their site, but the IRB also wants to know what's happening around the country, because your site might be conducting things and there might be no safety concerns there, but when the IRB steps back and looks at the study as a whole across 20 or 30 or 40 different sites, the IRB might consider safety a little differently as opposed to looking at it just through one small lens of your site. So hopefully these diagrams will sort of help you to be able to visualize sort of all the routes. The investigator will report to the sponsor and the IRB, and then at the same time we'll take information from the sponsor about other sites and report to the IRB. I know it's a lot to consider, so I'm happy to answer questions. We always have Karen Wood as our reference, but please, if there's anything about the adverse event and the serious adverse event that has you tripped up, stop what you're doing and drop me an email or call me or whatever works best for you, and I'd be happy to help you with this. Anyway, that's it. We're going to talk about audits next, and I will talk to you soon. Take care.